New tonight, the CDC is tracking more than 170 confirmed cases of monkeypox across the U.S. This virus is part of the same family of viruses as smallpox. And today, the New York City Health Department launched a public vaccination clinic for anyone who may have been exposed. Right now, the city makes up 20% of total cases, but the rise of cases has increased dramatically nationwide in just the last few weeks or so. But is it a reason for all of us to be alarmed? Certainly after a couple of years in a pandemic, our senses are heightened. Dr. Monica Gandhi is a professor at the University of California, San Francisco, specializes in infectious diseases. Doctor, I think let's start with just the basic thing. If COVID taught us anything, we have to get in front of something like this and get the word out. Is the World Health Organization a little late on the global warning?
Well, they're meeting tomorrow, like you said, and they're probably going to declare a global health emergency. But the reason they're doing that is it's not a pandemic. That's different. And they're doing it because it's actually been in Africa circulating for a while. And African countries, understandably, want this to happen so that we can think about vaccinating African countries and gay men, like you just showed, who are at risk. The general public should try to not feel alarmed because really we just came off of something and we need to have a break.
That's for sure. Talk about the U.S. response right now. The CDC, the Biden administration, what are they doing to message people about the risks and what is at stake?
Yeah, so basically this global health emergency, this outbreak started in May 13th when we started seeing cases reported to the World Health Organization. Now 3,100 cases around the world, 172 here in the US, as you said. And it really is an epidemic right now that is mainly in men who have sex with men. And so the CDC has issued guidance about essentially if you have active sores because it causes lesions, causes very distinctive lesions and sometimes fever and big lymph nodes, that's not the time to have sex. Kind of stay away during that time, isolate. And then the second question is the vaccine. We have a vaccine. This is totally different than COVID. We didn't have a vaccine when it started. We have a vaccine called Jynneos. And right now, the question that we're contemplating here in the United States is, should we ramp up production, which I think we should, and give it to essentially gay men? Just like you saw in New York City, that it's already started.
Right, and there was a line out the door. They had to turn people away, so there's interest in the vaccine. Quickly, before we move on, men having sex with men most susceptible to this, but does it spread in other ways? I mean, are there precautions that others should be taking?
Well, so it is really close contact. So either close skin-to-skin contact or close respiratory contact that can occur during sex. So not like sitting next to someone on a plane. You don't need to wear a mask for this. It's just that close contact. If someone has sores, let's not do close contact at that time.
More about the vaccine. What do we know about it? Availability nationwide. If they really want to tap into that resource, is it ready to go?
Yes, so it's called Jynneos, Jynneos. It is not live. We have 36,000 doses in the U.S. That's not enough because that's not enough for our gay male population. And the U.S. is looking to buy 500,000 doses. Canada just signed a deal for 56 million with the company to get their doses there, and so is the U.K. So we need to ramp up production, get those doses, and we'll probably just give it to gay men who have multiple sex partners right now.
And it's a 2-dose shot?
Yes, 2-dose shot, 4 weeks apart.
So they'll meet tomorrow, the World Health Organization, to determine whether or not they'll declare this international emergency. If they do that, what systems does that put into place?
What that allows is the fact that we've had this outbreak since May 13th, but actually this has been circulating in West and Central Africa since 1958, and they've had some major outbreaks in Nigeria, Ghana, other places. So what the global health emergency is, will also ramp up production of Jynneos to give to endemic regions in West and Central Africa. And the point is no one should be suffering from monkeypox, and we have the vaccine, so different than when we first got COVID. So it's going to be distribution in gay men, in around the world, and then in Africa, West and Central Africa, general populations.
All right. Some have been critical that they could have done that sooner in 2017 when we were seeing it in Nigeria. But here we are today. Dr. Gandhi, as always, appreciate it. Thank you.
Thank you.
Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.